Basically, an immediate loading is when we do screw retained prosthesis over the freshly placed implant. Instead of waiting 4 to 6 months with a traditional denture, which is how it's commonly done, and then doing the screw retained prosthesis at the 6-month mark, we do it immediately. Patient is able to have a fixed prosthesis over his implants instead of having a loose denture over, with a pallet over 6 months, which is extremely uncomfortable. And the screw retained prosthesis is a very low profile, bridge that it's not movable and look and feel very, very nice. So it's very popular. We do that with almost all of our cases, if not all, and our patients are very happy. They're super happy. Not all the patients are candidates for immediate loading. Most of them are. It's more about the amount of bone that the patient has, and also it has to do a lot with the ability of the clinician for placing the implants and achieving very strong or nice primary stability of the implants, which is basically that the implants are solid enough from the time of the surgery to be able to screw retain a prosthesis. So there are some times where we have to do some extensive bone grafting, and the implants do not achieve a very good initial stability. In the very rare cases, the case does not qualify for a screw retained prosthesis. But most of the time we're able to do screw retained prosthesis even with bone grafting procedures, or even with lack of bone, or it's just a matter of doing different techniques and using the very high quality of implant as well. Now, another thing that we do as well, a whole digital workflow which allows us to do a screw retained prosthesis very quickly, very nice, digitally made, and 3D printed. So the patient does not have to wait for the doctor to send it over to the lab and then wait until that's done so the patient can get the prosthesis. This is done immediately here. We scan everything digitally, we design digitally in our in-house lab, and we print the prosthesis. So he's able to walk out of here with the prosthesis screw retained.